accidents happen, but that's why we have emergency contraceptive pills. So what are emergency contraceptive pills exactly? Emergency contraceptive pills use a combination of drugs to prevent pregnancy after unprotected sex has occurred by interrupting a woman's normal hormonal cycle. Emergency contraceptive pills are also called the morning after pill, but do not have to be taken before or after intercourse has occurred. Emergency contraceptive pills are not a routine form of birth control. Who might need emergency contraceptive pills? So you might need emergency contraceptive pills if you forget to take your normal form of birth control, you were not using birth control when you had sex, your partner did not withdraw before ejaculation, your partner's condom broke or came off, you were forced to have unprotected vaginal sex, or you believe you were a victim of date rape. How do emergency contraceptive pills work? Simple. Emergency contraceptive pills delay ovulation and prevent pregnancy from occurring. They're not an abortion pill and cannot terminate pregnancy. Most emergency contraception has one pill that is ingested, and after that, it works in 3 simple steps. First, it prevents the womb lining from preparing to receive an egg, so even if the egg has already been released, it can't embed itself into the lining. 2, it influences the cervical fluid, thickening the mucus to prevent sperm from reaching the uterus. 3, it prevents the release of an egg from the ovaries by making the body think it has already occurred. So what types of emergency contraceptive pills are there? There are 3 major types: Plan B 1-step, Next Choice 1 dose, Ella. They cost range from $35 to $60. That is with your healthcare provider. So what are the differences? Ella works up to 5 days after unprotected sex. All women can use it unless you are breastfeeding, and after you must use a backup form of birth control, such as a condom, for 2 weeks. On the other hand, Plan B 1-step and Next Choice 1 dose work up to 5 days after unprotected sex, but it's less effective after day 3, and all women can use it. Some instructions for use. Take the morning after pill as soon as unprotected sex has occurred. Depending on the brand, they might have 1 to 2 pills. If there are 2 pills, the instructions on the brands might say to take them 12 hours apart. After you take emergency contraception, it is common for your period to be different than normal. It might be earlier or later, it could be heavier, lighter, or there could be more spotting. So which emergency contraception is for you? It could be a difficult and stressful time, so let's look at them a little bit closer and find one that's right. How effective are emergency contraceptive pills? Plan B 1-step and Next Choice 1 dose are roughly 89% effective if they're taken within 72 hours after unprotected sex. Emergency contraceptive pills can be taken up to 5 days after unprotected sex, but effectiveness is reduced the longer you wait. Ella is 85% effective if taken within 5 days. So what are some potential side effects? Most side effects are the same as normal birth control, such as irregular period, breast tenderness, dizziness or headaches, nausea or vomiting. These side effects are temporary as there have been no reports of serious complications. So, what are some advantages to using emergency contraceptive pills? If taken correctly, it can reduce pregnancy up to 75%. Emergency contraception is very safe as there have been no reports of serious complications. It is easy to access and there are no prescription needed if you are over the age of 18. Disadvantages to emergency contraceptive pills. There's only a limited window of time. They must be taken with 120 hours or 5 days after unprotected sex has occurred, but they're most effective within 72 hours. They don't protect against sexually transmitted diseases, and they don't terminate pregnancy once fertilization has occurred. So remember, always back it up with emergency contraception, just to be safe.